ICU acquired weakness and recovery from critical illness.
The pituitary gland, protected deep within the middle of the head, is often referred to as the master gland of the body, since it regulates many activities of other endocrine glands. Let's take a closer look at an enlarged view. Located above the pituitary gland is the hypothalamus. The hypothalamus decides which hormones the pituitary should release by sending it either hormonal or electrical messages.
Then explain who you are and who you have come to
If the
see.
hypothalamus released the growth hormone-releasing hormone, or GHRH, the pituitary would release growth hormone that would affect the body
The doors
tissue.
are electronic, so therefore cannot be pushed open. This is to aid privacy and dignity of patients and their loved ones. When entering the unit, there is a corridor followed by another set of double doors, where everyone should use the alcohol gel to clean their hands. Once through these doors, you are on the main unit, which consists of 10 intensive care beds. If you are not approached before, then head to the nurses' station, where you will be shown to the appropriate bed space. If the nurses, physicians, or doctors are busy with your loved one, then you may be asked to wait. When entering your loved one's bed space, you will be asked to remove your coat and clean your hands again.
There's a lot of different things that can cause it, and one of the first symptoms a woman usually has is she's not having periods or not having regular periods, and it sounds like this is the case with you, as you've been trying to have a third child, and you didn't have a problem with your first two. Many women don't have periods, they go seeking help, and this is sometimes a diagnosis that's found. High prolactin levels affect your ability to ovulate, and that's why it's hard to get pregnant. Certain medications can cause higher prolactin levels, and there are other explanations as well, and it can go along with other hormone imbalances.
Areas, for example, the shoulders and hip girdle.
Peripheral neuropathy is a common condition occurring when injury or disease damages your peripheral nervous system. Originating from your brain and spinal cord, peripheral nerves extend to your skin, muscle, and tissues. Your peripheral nervous system relays vital information between your body and the brain in the form of electrical impulses.
And interestingly, one of the largest
There are three types of peripheral nerves. Motor nerves regulate the movements of your body's skeletal muscles. Sensory nerves transmit sensations such as heat, vibration, touch, and pain to the brain. Autonomic nerves regulate the activities of internal organs and glands. Each nerve is made up of many interconnected cells, called neurons.
Facial and ocular muscles are rarely involved. Creatine kinase levels are not elevated in patients with critical illness polyneuropathy. The condition is distinct from the Guillain-Barré syndrome because the demyelinization is not seen.
The most common pituitary disease is indeed pituitary tumors. And it turns out that about 1 in 10 people in the population have a small pituitary tumor. And these are called incidentallomas because usually they're found by accident. So somebody comes in and needs a head scan because they're having a headache, or maybe they had a motor vehicle accident, and you find a tiny tumor in the pituitary. Most of these tumors are clinically insignificant. They do not produce hormone, nor do they knock out hormone production. The tumors that we worry about in the pituitary gland are tumors that actually overproduce hormone.
Other conditions that are generic to the ICU may adversely affect the peripheral nervous system. A catabolic state with skeletal muscle wasting is common and occurs rapidly in critically ill patients, particularly those with sepsis. Early mobilization of patients in ICU, although not a traditionally approach, has become established as an evidence-based strategy to reduce the deconditionation and dysfunction so commonly seen in survivors of critical illness.
Within intensive care medicine, we've gotten better at helping patients survive their severe illness in the intensive care unit. And as a result, we have a growing number of patients who are ICU survivors. As this patient population grows, we're beginning to understand the consequences these patients have when they go home. We've understood that patients have many problems with muscle weakness that prevents them from returning to work and requires prolonged rehabilitation. We've also recognized that there are many difficulties with depression, anxiety, and post-traumatic stress disorder related to their ICU stay. As a result of this, we've begun to rethink how we provide care to patients in the intensive care unit.
Systemic inflammation and oxidative stress are associated with reduced muscle strength. Diaphragm wasting, which has been extensively described in animal models of full mechanical ventilation, has also been described in study in humans. Muscle inactivity is a potent stimulus for protease activation, leading to muscle protein breakdown and activation of the ubiquitin proteasome pathway of proteolysis.
Here's another great video discovered and brought to you by Nursing Shepherd. For more information, please visit www.nursingcareertips.com. Thanks for watching and enjoy the video.
Big cough for me, okay, Marquis?
Brad Scott
There we go.
enjoys taking care of people.
Before I became a nurse, I was a paramedic. So I had 3 years experience as a paramedic on the ambulance before I ever went to nursing school.
His intensive care patients
Squeeze my fingers for me. Oh, that's good, that's good, that's good. That's real good.
need a lot of specialized care.
Our patients, they can't talk, but they have just as many needs, if not more needs.
So what is a typical day like?
Come in, give a report, assess one patient at a time, take my time, make sure I cover all the bases, and then move on to the next guy. The reward in this type of nursing is...
Thank you.